just want to say thank you guys for coming to my speech. My name is Chevier. We're going to talk about infertility. Infertility is the inability to become pregnant after trying for 12 consecutive months. Infertility affects nearly 25 million couples in the world. Today, I am going to talk with you about the different symptoms to look for, some ways infertility is caused, the tests that can be done to diagnose infertility, and finally, some treatment options to help couples achieve their lifetime goal of having children. I myself am a young woman who would love to have biological children of my own one day, but have been faced with infertility issues through the years despite today's technology. With that being said, let's start learning about infertility and some symptoms that might help you or someone you know with getting help for infertility problems. There are many early signs of infertility in women. The most noticeable sign of infertility is failure to become pregnant within a 12-month time frame. Another common warning symptom among infertile women is irregular menstruation. Some women may get repeated menstruations in a month's time, while other women may not even experience one a month. According to the American Fertility Association webpage, about 25% of all pregnancies end in miscarriage. While the causes of the miscarriage will not be discovered around 50% of the time. While these signs of infertility may be most common, there are also many signs that may not be as noticeable. In most cases of infertility, the causes are from problems with ovulation. Approximately 10% of couples are affected by endometriosis, which is the abnormal growth of cells similar to those that form the inside of the uterus, but in a location outside of the uterus. Growth occurs not only in the uterus, but also elsewhere in the abdomen, such as in the fallopian tubes and the ovaries. Another cause of infertility includes PCOS, polycystic ovarian syndrome, which occurs when women have too many male hormones and not enough female hormones, making ovulation rare or irregular. Women ovulate when an egg-containing follicle grows and releases a mature egg. PCOS keeps the follicles from growing, causing them build up in the ovaries and form small benign cysts. According to the Endometriosis Foundation of America webpage, approximately 176 million women and girls worldwide suffer from endometriosis. 8.5 million in North America alone, and the associated cost of the disease are estimated to be a staggering $22 billion annually. There are also many other conditions that come along with having endometriosis, such as eating disorders, hypothyroidism, bipolar disorders, depression, and fibromyalgia. The first step in diagnosing infertility is to schedule a consultation with an infertility specialist, also called an endocrinologist. Blood tests are a major part of the testing, which measure the levels of various hormones, which include but are not limited to estrogen, progesterone, and follicle-stimulating hormone. Ultrasounds are also used to check the shape of a woman's uterus and the thickness of the uterine lining. Laparoscopy, which according to the WebMD webpage for infertility is the most common procedure used to diagnose and remove mild to moderate endometriosis by directly viewing the pelvic organs and relieving endometriosis pain for the patient. Checking basal body temperature, which is your body's temperature when you're completely at rest, is another common test to determine if ovulation has occurred or will occur in the near future. An individual's treatment plan will depend completely on the cause or causes behind their infertility. Medicine or hormone treatments are often the first steps in fertility treatments. If a woman is having irregular ovulation, using medicine or hormones to stimulate ovulation will increase her chances of getting pregnant, but the treatments could also increase a woman's risk of having multiple births, twins, triplets, or quadruplets. In vitro fertilization, which is the combining of a woman's egg and a man's sperm outside the body in a laboratory and then placed back inside the uterus once the embryos are formed, is another costly treatment for infertility. While there are many treatment options for couples who suffer from infertility, there are also alternative options which include acupuncture, dietary changes, and relaxation techniques. Today, I have discussed with you many important things about infertility, from the symptoms women face to the treatment options available. While infertility may be a difficult situation to deal with, just know that there are always options available to help you achieve your dream of having a family. Thank you.